Does it feel like everyone around you has gotten pregnant or had a baby during lockdown? Here to tell us whether the pandemic has been more of a baby boom or a baby bust is Dr. Marjorie Dixon. Is it a baby boom or are we just sort of seeing things right now?
I think you're just seeing things because, initially when people were talking about we're going to lock people down, families are going to be together, partners are going to be together, it's going to be like a big blizzard or maybe a blackout where people have nothing to do but get together, and then babies come thereafter. But what experts are noting is that the pandemic actually equates to a baby bust because we have the lowest growth rates in our population since 1946, which was the end of the war, if you'll remember the beginning of the baby boom. So that's a long time ago. And actually, we'll see fewer babies in the winter of 2020, in the winter of 2020 and into 2021 than we've seen in a long time. In the third quarter of last year, there was a flat growth rate, 0%.
Why are people delaying having children or just deciding not to go for it right now?
For a lot of people, this is apocalyptic, right? And people are home, and some people feel real tremendous economic risk at this time, right? Mm-hmm. So people are feeling like maybe it's not safe, and then to do this because I don't know, am I going to have a job, or my partner might have lost their job? And then there is the whole possibility that, cost, like kids are expensive. You have them, I have them. And even during the pandemic, we're looking at things like computers or electronics, or you have to up your Wi-Fi during the time. Like people are concerned about if we are in an economic recession and they're on unemployment insurance, how would they pay for kids? So there's that. Kids are expensive. You have to be isolating. Mm-hmm. So things are on hold. Weddings are on hold. And people are worried, right? Like social distancing. Like how do you connect to make a baby with social distance? I think women are worried that maybe they don't want to go see their obstetricians in the hospitals and their practices.
Delaying parenthood, are there some consequences here?
Yeah, absolutely. We talk about the trying to conceive community all the time, and women are very cognizant of kind of their reproductive lifespans having a limitation. And honestly, we talk about ovaries like egg storage units, and over time it diminishes, and women are getting older having our babies, and those are some of the largest hurdles that we're encountering. So for some women, it's incredibly stressful. In our 30s rather, we have about a 20% chance of pregnancy per cycle only. And then into our 40s, only 5% per cycle. So if you're at home and you are thinking, or you're in the trying to conceive community and you're thinking about, I want to access my care, you're feeling a little stressed out by virtue of the fact that you understand that your ovaries are egg storage units and we can't replenish them. They can actually freeze their eggs or freeze their embryo. So freezing eggs is an option if you don't have a partner as a woman and you're wanting to have the opportunity of something in the future. And actually now with vitrification, we've talked about this, vitrification allows us to freeze eggs and use them in the future, and you're not worrying about your egg aging. But when you're making embryos, if you have a partner, you're not ready to have a baby right away, we can create embryos in the laboratory through in vitro fertilization and cryopreserve those embryos for future use.
Okay, we want to touch briefly on the COVID vaccine and women who may be pregnant or want to become pregnant. Can you tell us a bit about that?
It's an mRNA vaccine, which is very different than the traditional vaccines that we are used to counseling patients about. The mRNA is like the little message or the blueprint for a piece of the spike protein. So you see that ball and then all the spikes that come out of it. So the way that the vaccine works for creating what we call adaptive immunity is it gives you a little piece of that message, the blueprint for that spike protein. And then once it gets into your body, it uses your own cytoplasm in your own cells and the ribosomes, think about high school biology, that translate that message into a protein, and then your own immune system reacts to it. So you're not being exposed to live virus. That's a big misconception in the lay press, and people are very worried about potentially what impact it would have. So the societies that help us to guide us in our management of patients for obstetrics and gynecology have come out with a statement that says, we know that the clinical trials did not include pregnant women and lactating women. So all of the trials that were looking at this new type of vaccine didn't include that population. So the truth is we don't know if we can counsel people towards it or against it, because we don't really know if there's risk, and it's also so new. But if you are a higher risk in pregnancy, which means if you're over 35, if you're obese, if you have hypertension or diabetes or other medical comorbidities, lung disease, a history of lung disease or pneumonia, and your risk, if you were to contract COVID-19 in pregnancy, would be greater than the risk of the potential exposure in the vaccine, then maybe it is advisable that you actually do get the vaccine and you complete both of them. So you have 2 injections of the vaccine in order to develop the antibodies and the immunity. The recommendation is that if you are counseled to get the vaccine in pregnancy or pre-pregnancy, that you complete the course of the 2 injections before then you go on to conceive.
Really good information there, Doc. Thank you for that. You're helping a lot of people with that info.